There were some instances and certain providers that are really dedicated to helping families and caregivers go through this process. They have a big frustration too, which is that because of the reimbursement system in the U.S., they don't get paid often for counseling or phone consultations. But there are certain providers that have worked around it, for example, by hiring a nurse practitioner to field phone calls from family caregivers, where they're getting the expert advice, even if they're not speaking directly to a clinician. It's a means for the family to pick up the phone, get an answer from a knowledgeable caregiver, and really foster the communication. I think one of the big issues is communication. And when family caregivers can communicate with the clinical side of the process, everybody benefits. Very often they're afraid to pick up the phone. So if they know that there's somebody at the other end that has the time and the expertise to talk them through a difficult situation or a difficult problem, it makes the whole caregiving process run smoother. I think one of the other things that's happening is we're seeing a big move now towards team-based care. And what that involves is physicians and specialists and therapists and social workers all collaborating together so that each one is not working in a clinical silo anymore, but that they're actually collaborating and talking to each other to figure out what's best for the patient, what's best for this person. How can we help him or her live their life to the fullest and provide quality of life? And we're seeing a very slow but steady shift away from this treatment-based approach to a wellness, holistic, quality of life kind of approach. The providers I spoke with are the ones that are primarily at the forefront of this effort, but they're really making some progress, and they're really trying to do what's best for the patient and the family. So they're not necessarily treating the disease as much as providing a better life for the person involved. And that's very encouraging.